What is recovery like?
Recovery can be very difficult, and I don't want to underemphasize that because it's a big change to the face. Usually you're wrapped in an ACE wrap for a week at least, and that gives some support to all the tissue underneath. You'll have an incision in your hairline or in your hair, depending on what we decide before surgery. That incision, if it's exposed in the front here, needs to be taken care of and kept moist. It's very difficult sometimes to get to a point to wash your hair, but that's very important because you may have some dry blood and debris in your hair, and that's a big step in getting it washed. You also have a cast on your nose if we decide to do rhinoplasty. And after rhinoplasty, you have some bruising and swelling around the eyes. Speaking of eyes, your eyes in the first 24 hours can actually swell shut. Sometimes I will give steroids and really ice the eyes, and that minimizes any swelling, at least to a point where you can see. If you have a lip lift, there'll be an incision underneath the nose here. And all of these stitches that will be here and hairline, they come out at a week. So all of these areas that have stitches have to be taken care of and kept clean and kept moist. And one of the hardest procedures to recover from is jaw contouring. The incision itself is inside the mouth, so you really don't have to do anything from that standpoint, but you get a lot of swelling. And so sometimes it's hard to eat, sometimes it's hard to talk, but it will gradually go down, and usually most people have the hardest time with that one because it still looks very swollen even a week afterwards. The Adam's apple reduction is very easy to recover from, actually, as far as procedures go. I have a small incision here and leave a purple glue that's water safe, so you can, get it wet and you don't have to keep ointment on it. Overall, most people take 3 to 4 weeks off of work, and that's just to allow all the bruising to go down, especially with the jaw, allow the swelling to go down enough to where they can be presentable in public. The incision won't quite yet have hair start growing through it, but at least it'll be to a point where you can wear makeup over it, and you can generally go about your day without wearing dressings or anything like that. So it's a difficult procedure to recover from, but well worth it because the results are dramatic. The final results, I usually tell my patients you don't really see for about a year because it really takes a year for all the swelling to go down. And that's just because it's a lot of surgery, and it keeps changing over time little by little.
Power and beauty.